Question 1. From a practical standpoint, Sarah, a radiology administrator at a large urban hospital, is tasked with reviewing the equipment utilization and lifecycle data of several high-value imaging devices, including MRI and ET machines. Over the past 6 months, she noticed one MRI machine had excessive downtime, inconsistent preventive maintenance records, and increased repair costs. The equipment is also reaching the end of its depreciation cycle. Her department is preparing the capital expenditure request for the upcoming fiscal year. Given this context, what should Sarah do to justify the replacement of the MRI unit in a way that aligns with both financial prudence and operational efficiency? A. Emphasize the machine's repair costs alone as justification for replacement. B. Submit request highlighting manufacturer warranties and compare them across vendors. C. Provide comprehensive return on investment (ROI) analysis including downtime impact, repair trends, and patient throughput. D. Recommend repair of the machine due to budget limitations without conducting financial analysis. Answer. Correct answer. C. Provide a comprehensive return on investment (ROI) analysis including downtime impact, repair trends, and patient throughput. Explanation. This question assesses understanding of capital planning, asset utilization, and financial justification of large expenditures. According to best practices in capital planning and ROI analysis in healthcare, replacement decisions should be based on quantifiable data such as increased maintenance costs, downtime affecting patient care, and comparisons with newer models' operational efficiency. Simply citing costs A or vendor warranties B is insufficient. Ignoring full analysis due to budget D may lead to poor long-term outcomes. ROI analysis, which includes cost-benefit evaluation, is standard approach endorsed by AHRA and AHRA financial management guidelines. Question 2. As a result of a recent staffing audit, a radiology department discovered inconsistencies in technologist scheduling, including frequent overstaffing during non-peak hours and understaffing during weekends. Which of the following strategies would best support the department in optimizing productivity and improving patient throughput while aligning with labor regulations? A. Implement rotating shifts based on average weekly patient volume data trends. B. Mandate fixed overtime scheduling during weekends to ensure coverage. C. Reduce staff numbers across the board to lower operational costs. D. Increase PRN staff without adjusting current full-time schedules. Answer. Correct answer. Implement rotating shifts based on average weekly patient volume data trends. Explanation. This relates to scheduling optimization, productivity, and compliance. Rotating shifts aligned with data-driven patient volumes ensure better resource utilization and support patient flow. Labor regulations, such as Fair Labor Standards Act FLSA, discourage mandatory fixed overtime B without proper compensation. Blanket staff reduction may compromise patient safety and quality. Adding PRN staff without adjusting current schedules D may result in overstaffing and inflated labor costs. Tools like Lean Six Sigma and our productivity benchmark support shift optimization based on utilization data. Question 3. Given the circumstances, Dr. Patel, a newly credentialed radiologist, has submitted his application for hospital privileges. The credentialing committee is concerned about a 6-month employment gap and inconsistent documentation from a previous facility. What should the committee prioritize during the privileging process to maintain compliance and patient safety? A. Immediately grant privileges due to a shortage of radiologists. B. Require primary source verification and conduct peer reference checks. C. Defer the application indefinitely until Dr. Patel provides all documents. D. Grant temporary privileges without full background verification. Answer. Correct answer. B. Require primary source verification and conduct peer reference checks. Explanation. This scenario involves credentialing and privileging critical to patient safety and regulatory compliance, according to the Joint Commission MS.06/0103 and National Committee for Quality Assurance (NCA) standards. Primary source verification (PSV) of licensure, training, and references is mandatory. Granting privileges prematurely A. D. poses legal and clinical risks. Deferring indefinitely C. without due process may violate provider rights. PSV and peer reviews ensure the applicant meets minimum competency and ethical standards. Question 4. Throughout the course of the year, a large outpatient imaging center has struggled with low staff morale, increased turnover, and negative employee engagement survey results. Leadership wants to implement a sustainable strategy to reverse the trend. Which of the following approaches aligns best with evidence-based employee engagement practices in healthcare? A. Provide mandatory team-building retreats quarterly. B. Link engagement scores to individual performance bonuses. C. Conduct stay interviews and implement real-time feedback loops. D. Introduce disciplinary policies to discourage complaints. Answer. Correct answer. C. Conduct stay interviews and implement real-time feedback loops. Explanation. This question focuses on employee engagement and satisfaction strategies. Modern HR practices, including those outlined by Gallup and AHRA, emphasize stay interviews to understand reasons employees remain or consider leaving, and timely feedback mechanisms. These create a culture of transparency and proactive management. Mandated activities. A. Financial incentives alone. B. Don't address underlying issues. Disciplinary measures. D. For expressing dissatisfaction are counterproductive and may violate AHRA and whistleblower protections. Question 5. In a modern context of patient-centered care, a radiology manager is updating operational procedures to comply with HIPAA and ensure secure handling of patient records during equipment servicing. What is the most appropriate action to take when a vendor technician needs to access PACS-connected equipment? A. Allow access without restrictions as long as supervised by its staff. B. Require the technician to sign a business associate agreement. B. C. Provide unrestricted remote access to minimize on-site time. D. Limit technician access to office hours regardless of urgency. Answer. Correct answer. B. Require the technician to sign a business associate agreement. By explanation. When vendors handle protected health information, even incidentally, a business associate agreement is mandated under HIPAA 45 CFR 164.502e. Simply supervising access A or granting open remote access C without contractual safeguards is non-compliant. Limiting it arbitrarily. D. May disrupt critical operations. The BOD defines responsibilities and liabilities of vendors in protecting and is foundational compliance requirement in radiology workflows. Question 6. By evaluating performance reviews across departments, a radiology department head observed wide disparities in evaluation criteria used by different supervisors. Some employees feel the reviews are inconsistent and biased. What is the best step can take to standardize performance management and ensure fairness? A. Ask each supervisor to continue their current methods. B. Implement a competency-based evaluation system tied to role expectations. C. Outsource evaluations to an HR consultant firm. D. Allow employees to choose their preferred evaluator. Answer. Correct answer. B. Implement a competency-based evaluation system tied to role expectations. Explanation. This addresses performance management in employee evaluations. A competency-based system ensures evaluations reflect measurable performance aligned with job descriptions and departmental goals in accordance with HR best practices and EOC guidelines. Allowing inconsistent methods A or arbitrary evaluator selection D can result in indiscriminate practices, while consultants C may assist. Internal consistency and leadership accountability are paramount. AHRA recommends standardized frameworks for healthcare evaluations. Question 7. In contrast to many departments, the imaging services team at Riverside Health noticed a sharp increase in supply wastage and inventory discrepancies over the past quarter. As the department head investigates which inventory control strategy would most effectively enhance accountability and prevent misuse. A. Rely solely on periodic physical counts. B. Transition to a barcode-based automated inventory system. C. Assign inventory tracking to individual technologists manually. D. Order larger volumes of supplies to reduce unit cost. Answer. Correct answer. B. Transition to a barcode-based automated inventory system. Explanation. This question relates to inventory management of radiologic supplies. Barcode and RFID systems provide real-time inventory tracking, usage data, and shrinkage reduction. Periodic counts they are insufficient for high-volume, high-turnover departments. Manual tracking C is error-prone. Overordering D may increase wastage and tie up capital. Per AHRA and AHRA guidance, automation supports just-in-time inventory models, improves accuracy, and aligns with lean healthcare principles. Question 8. Taking into account employee development, Maria, the imaging manager, wants to launch a professional growth program to retain top performers and prepare future leaders. Which initiative aligns best with long-term workforce planning and succession development? A. Offer tuition reimbursement without formal mentorship programs. B. Provide routine compliance training and stop there. C. Establish a mentoring program and leadership development track. D. Restrict training opportunities to management-level staff only. Answer. Correct answer. C. Establish a mentoring program and leadership development track. Explanation. This question assesses staff development and succession planning. Structured mentorship and leadership development ensures skill continuity and reduces reliance on external hires. Offering tuition alone A. Lacks direction. Compliance training B. Addresses regulatory needs, not leadership growth. Limiting training D. Ignores high potential frontline staff. AHRA and ASSET emphasize that future leaders are cultivated through plan, role-specific development strategies. Question 9. Despite the fact that the department followed OSHA protocols, a radiation safety audit revealed insufficient documentation of equipment inspections and training. To rectify this, which action would most directly address both compliance and staff safety? A. Update equipment only when malfunctions are reported. B. Provide annual refresher training and maintain signed logs. C. Allow staff to opt out of radiation training after 5 years. D. Outsource safety training to vendors without oversight. Answer. Correct answer. B. Provide annual refresher training and maintain signed logs. Explanation. This question focuses on radiation safety and AHRA compliance. Per OSHA NRC and the Joint Commission, annual training with documented participation is essential. Reacting to malfunctions A is reactive. Opt-outs C. Violate ongoing training mandates. Unsupervised outsourcing D. Fails to ensure quality or accountability. Consistent documentation proves regulatory adherence and fosters radiation awareness culture. Question 10. In light of recent developments, a radiology department has experienced an increased number of incident reports involving contrast media administration errors. A root cause analysis points to inconsistent workflows and lack of cross-checking. What is the most appropriate corrective action? A. Assign blame to technologists and issue disciplinary warnings. B. Eliminate contrast usage until new machines arrive. C. Standardize contrast administration protocols and conduct team-based simulations. D. Allow individual departments to create their own informal protocols. Answer. Correct answer. C. Standardize contrast administration protocols and conduct team-based simulations. Explanation. This question evaluates incident reporting, root cause analysis, and corrective action. Standardized protocols and interdisciplinary training simulations address workflow inconsistencies and promote safety, aligning with the Joint Commission's national patient safety goals. Blame-based culture discourages reporting. Avoiding B. May hinder diagnostics. Informal protocols D. Risk non-compliance. Simulation-based training is supported by AHRA's proactive safety measure. Question 11. From a practical standpoint, a radiology administrator at an urban hospital is evaluating how to manage the high staff turnover rate in the CT department. The administrator discovers exit interviews show consistent complaints about lack of growth opportunities and poor mentorship. Which of the following strategies would most effectively address these issues while aligning with workforce retention best practices in healthcare? A. Increase the number of staff meetings to promote team cohesion. B. Partner with external training providers to deliver technical upskilling only. C. Develop an internal coaching and mentoring program tied to career pathways. D. Offer quarterly bonuses for attendance and punctuality. Answer. Correct answer. C. Develop an internal coaching and mentoring program tied to career pathways. Explanation. Option C is correct because coaching and mentoring programs that tie directly to career advancement pathways have been shown to increase job satisfaction, engagement, and retention in healthcare settings, according to the Society for Human Resource Management (AHRA) and American Hospital Association. AHRA Workforce Reports internal development opportunities are a key driver of staff loyalty. Mentorship also improves organizational knowledge retention and leadership development. Option A improves communication but does not address growth. Option B focuses only on technical training, which is insufficient if not paired with career support. Option D offers extrinsic motivation but lacks long-term developmental value. Question 12. In light of recent developments, a radiology department is transitioning to digital tracking for all imaging equipment as part of asset lifecycle management. Which of the following metrics would be most useful in determining when a high-cost MRI scanner should be replaced? A. Number of service calls per year. B. Manufacturer's warranty expiration. C. Annual depreciation rate. D. Comparative cost per scan versus benchmark facilities. Answer. Correct answer, D. Comparative cost per scan versus benchmark facilities. Explanation. Option D is correct because cost per scan is a key performance indicator used in capital asset management and financial justification for replacement. It reflects the total cost of ownership and operational efficiency relative to peers. High cost per scan may indicate inefficiency or aging equipment. Option A and B are indicators of maintenance needs but do not directly reflect financial performance. Option C is part of accounting but not a decision-making metric for replacement justification. Refer to HFMA guidelines and American College of Radiology, AHRA, capital planning best practices. Question 13. When evaluating the merits of a performance improvement initiative targeting patient wait times in ultrasound, the radiology manager uses lean methodology. After mapping the current workflow, she identifies multiple delays between patient arrival and scan start. Which lean tool would be most appropriate to visualize and address these delays? A. Root cause analysis tree. B. Value stream mapping. C. Ishikawa-Fishburne diagram. D. Control chart. Answer. Correct answer, B. Value stream mapping. Explanation. Option B is correct because value stream mapping, VSM, is a core tool in lean methodology to map out each step of a process and identify non-value-added activities. It is particularly effective in healthcare workflows where patient flow and time delays are critical. Option A and C are root cause tools used after a problem has been identified. Option D is used in Six Sigma to monitor performance over time, not for initial process mapping. Refer to Lean Healthcare Implementation Guide (IHI) and Joint Commission's PI standards. Question 14. In the context of compliance with radiation safety standards, a radiology department implements AHRA principles and monitors technologist exposure. Despite controls, one technologist consistently exceeds monthly dose limits. What should be the administrator's first course of action? A. Reprimand the technologist and require additional training. B. Increase lead shielding in all imaging suites. C. Conduct task-level job hazard analysis for the technologist's workflow. D. Temporarily remove the technologist from duty until exposure resets. Answer. Correct answer, C. Conduct a task-level job hazard analysis for the technologist's workflow. Explanation. Option C is correct because when occupational exposure is consistently high, the NRC and OSHA recommend performing task-level hazard assessment to evaluate contributing factors such as proximity to source, PPE use, or protocol adherence. Option A assumes fault without investigation. Option B is blanket solution and may not target the root cause. Option D could violate employment rights without documented risk mitigation process. Refer to NRC to CFR Part 20 and OSHA Ionizing Radiation Standard 1910.1096. Question 15. Considering the evidence, a radiology administrator needs to justify the acquisition of a second PET-ET scanner to hospital leadership. What financial justification approach would be most appropriate to support this capital expenditure request? A. Calculate depreciation expense to reduce tax liability. B. Show break-even analysis of procedure volume and reimbursement. C. Compare the new scanner's service contract to competitors. D. Submit anecdotal evidence from physicians requesting faster access. Answer. Correct answer. B. Show break-even analysis of procedure volume and reimbursement. Explanation. Option B is correct because break-even analysis demonstrates how long it will take for the investment to pay for itself through increased procedure volume and associated revenue. This aligns with HMA and AHRA capital investment evaluation models. Option A is not typically relevant to nonprofits. Option C is part of cost comparison but insufficient alone. Option D lacks objective financial data. Refer to AHRA's Strategic Financial Planning for Radiology Administrators. Question 16. During the process of budgeting, a radiology administrator identifies that a large portion of last year's operational expenses were due to unplanned equipment downtime. To reduce future variance, which budgeting strategy is most effective? A. Shift to zero-based budgeting. B. Implement rolling forecasting. C. Use last year's budget as baseline. D. Defer maintenance to reduce short-term costs. Answer. Correct answer. B. Implement rolling forecasting. Explanation. Option B is correct because rolling forecasting allows continuous budget updates based on new information such as unexpected maintenance costs. It improves responsiveness to dynamic financial environments. Option A is time-intensive and may not address the specific issue. Option C perpetuates past inefficiencies. Option D increases long-term risk and is against Joint Commission equipment reliability standards, CRA budgeting best practices, and AHRA capital management principles. Question 17. Based on the information, Dr. Nguyen, a radiologist, has recently joined the facility. The credentialing committee must validate his qualifications. What is the most critical step in the privileging process for radiologists? A. Confirming years of prior employment. B. Verifying board certification and state licensure. C. Reviewing references from personal acquaintances. D. Issuing provisional privileges based on resume. Answer. Correct answer. B. Verifying board certification and state licensure. Explanation. Option B is correct. Credentialing and privileging are governed by CMS, the Joint Commission, NCA. Board certification and active state licensure are essential for verifying qualifications and authorizing clinical duties. Option A is helpful but not sufficient. Option C lacks objectivity. Option D bypasses formal review and can jeopardize patient safety. Refer to the Joint Commission MS.06, 01, 03 and CMS Conditions of Participation 482.22. Question 18. To determine whether productivity optimization is successful in the nuclear medicine division, the administrator monitors various KPIs. Which metric best reflects labor productivity in relation to patient care efficiency? A. Number of overtime hours logged per week. B. Number of procedures per technologist per shift. C. Average downtime between scans. D. Total annual salary cost per department. Answer. Correct answer. B. Number of procedures per technologist per shift. Explanation. Option B is correct because productivity in imaging is typically measured by procedures per FTE or shift. It reflects efficiency in balancing labor and service demand. Option A relates to staffing stress but not productivity. Option C affects throughput but not directly tied to labor. Option D is a cost figure, not a productivity ratio. Refer to AHRA staffing benchmarks and NGMA imaging services metrics. Question 19. In a modern context of unionized environments, a hospital radiology administrator is handling a grievance regarding shift scheduling. The technologists claim a seniority clause was violated. What should the administrator do first in accordance with union regulations? A. Refer to the collective bargaining agreement, EBA, for guidance. B. Conduct an independent staff poll on preferred schedules. C. Temporarily reassign shifts to appease staff. D. Consult the legal department for contract termination options. Answer. Correct answer. A. Refer to the collective bargaining agreement, CBA, for guidance. Explanation. Option A is correct because the CBA is the binding document in unionized workplaces. It governs grievance procedures, seniority rights, and arbitration mechanisms. Option B and C can breach EBA terms and undermine the process. Option D is an extreme response and inappropriate at this stage. Refer to National Labour Relations Act AHRA and local union contract articles. Question 20. Examining the consequences of poor documentation in radiology billing, an audit reveals numerous CPT code errors resulting in denied claims. Which approach is most effective in improving documentation accuracy and ensuring compliance? A. Schedule annual billing refresher courses. B. Automate billing using standard templates. C. Implement a real-time coding review system integrated with RIS. D. Outsource coding to external vendors. Answer. Correct answer. C. Implement a real-time coding review system integrated with RIS. Explanation. Option C is correct because real-time coding systems integrated with Radiology Information Systems RIS enhance documentation accuracy by providing immediate feedback. This minimizes denials and aligns with CMS billing compliance and OIG audit risk mitigation. Option A is insufficient alone. Option B may still allow errors if data entry is poor. Option D adds cost and doesn't improve internal practices. Refer to CMS Program Integrity Manual and AHRA Imaging Informatics Guidelines. Question 21. A hospital is aiming to improve its radiology department's operational efficiency. After evaluating the imaging equipment usage reports, the administrator observes significant gaps in the utilization of the CT scanner during evening shifts. What should be the next step in addressing this underutilization? A. Reduce staffing levels during evening shifts to match demand. B. Renegotiate contracts with insurance providers to increase evening imaging volume. C. Evaluate scheduling patterns to identify opportunities for optimizing patient appointments during evening hours. D. Increase the pricing for evening CT scans to encourage more patients. Answer. Correct answer. C. Evaluate scheduling patterns to identify opportunities for optimizing patient appointments during evening hours. Explanation. Option C is correct because optimizing scheduling patterns is the most effective way to improve equipment utilization without reducing staff or increasing prices. Operational efficiency can be enhanced by ensuring the equipment is used more efficiently during off-peak times. Option A could negatively impact service levels. Option B and D do not directly address operational inefficiencies and may involve unnecessary complexity or costs. Refer to AHRA's Healthcare Operations and Efficiency Best Practices. Question 22. A radiology administrator has been tasked with improving patient throughput in the MRI department. After analyzing patient feedback and staff reports, she discovers that the time spent between MRI patient intake and actual scan initiation is too high. Which of the following initiatives should she implement first? A. Increase the number of MRI machines available. B. Implement a lean management approach to identify process bottlenecks. C. Encourage patients to arrive earlier for their appointments. D. Offer patients a discount for participating in evening sessions. Answer. Correct answer. B. Implement a lean management approach to identify process bottlenecks. Explanation. Option B is correct because lean management will help identify and eliminate process inefficiencies, thereby reducing unnecessary delays and improving overall patient throughput. Option A might not be necessary if bottlenecks in the process can be resolved. Option C could be helpful but does not address internal process inefficiencies. Option D may increase patient volume but does not address the underlying problem of delays. Refer to Institute for Healthcare Improvement, AHRA Lean Principles. Question 23. A hospital's radiology department needs to meet the required standards for maintaining radiation safety. To ensure compliance, which of the following measures is most critical for the department to adopt? A. Ensure all staff members have up-to-date training on radiation safety protocols. B. Purchase the latest high-tech radiation shielding equipment. C. Focus on increasing patient throughput to offset radiation exposure levels. D. Decrease the number of scans performed on high-risk patients. Answer. Correct answer. A. Ensure all staff members have up-to-date training on radiation safety protocols. Explanation. Option A is correct because regular radiation safety training for staff is critical to maintaining compliance with NRC, OSHA, and OPAM standards. Training ensures proper handling of radiation sources and protects both patients and staff. Option B is a good safety measure, but training is the most important. Option C and D do not directly address radiation safety protocols or proper training. Refer to NRC to CFR Part 20 and AHRA Radiation Safety Guidelines. Question 24. In response to a significant increase in MRI scan volume, the radiology administrator is exploring options for optimizing the department's performance. What metrics should the administrator focus on to assess the department's efficiency in utilizing MRI resources? A. The number of MRI scans conducted per month. B. The average time between patient check-in and MRI scan completion. C. The number of staff working per shift. D. The total annual budget allocated for MRI procedures. Answer. Correct answer B. The average time between patient check-in and MRI scan completion. Explanation. Option B is correct because reducing wait times is a critical factor in improving operational efficiency. This metric directly reflects the department's ability to utilize MRI resources effectively and efficiently. Option A only provides volume data but doesn't reflect efficiency. Option C and D are related to resources but don't directly reflect the actual performance in terms of time management. Refer to AHRA Operations Efficiency Best Practices. Question 25. To comply with government regulations, a radiology administrator needs to ensure the hospital's imaging equipment meets all operational standards. Which of the following documentation is most essential for validating that the hospital's imaging equipment is compliant with federal safety standards? A. Records of routine service and maintenance performed on the equipment. B. List of all imaging equipment installed within the facility. C. Inventory of spare parts for the imaging equipment. D. Copies of patient feedback regarding imaging procedures. Answer. Correct answer. A. Records of routine service and maintenance performed on the equipment. Explanation. Option A is correct because maintaining comprehensive service and maintenance records is essential for demonstrating compliance with FDA and NRC regulations. These records verify that imaging equipment is regularly inspected, calibrated, and maintained to meet safety standards. Option B, C, and D do not focus on compliance-related maintenance. Refer to FDO's Radiological Health Program and NRC Part 35 regulations. Question 26. A hospital radiology administrator is tasked with enhancing the department's financial health. Which of the following strategies would be the most effective in improving reimbursement for imaging services? A. Introduce bundled payment options for radiology services. B. Increase the number of imaging procedures performed per day. C. Negotiate higher rates with insurance providers. D. Reduce the number of high-cost imaging modalities to save on operational costs. Answer. Correct answer. A. Introduce bundled payment options for radiology services. Explanation. Option A is correct because bundled payment options have been found to improve reimbursement rates by simplifying billing and providing cost predictability. This method can also help ensure better care coordination and enhance the overall financial stability of the department. Option B could lead to overutilization, which may result in low reimbursement or compliance issues. Option C may not always be feasible or sustainable depending on the payer mix. Option D could reduce operational costs but not necessarily improve reimbursement. Refer to EMS bundled payments for care improvement (EI) models. Question 27. When managing a radiology department, the administrator notices a significant increase in the number of delayed or missed appointments. Which of the following actions would be most effective in reducing these occurrences? A. Implement automated reminder systems for patients. B. Offer discounts for patients who book imaging appointments during off-peak hours. C. Reduce the number of patients scheduled per day to alleviate stress. D. Focus on increasing physician referrals to increase appointment volume. Answer. Correct answer. A. Implement automated reminder systems for patients. Explanation. Option A is correct because automated reminder systems have been shown to reduce no-shows and appointment delays by providing patients with timely reminders. Option B may not be effective if patients are not aware of their appointment time. Option C could reduce patient volume but not necessarily address the root cause. Option D. Could increase the load on the department without addressing the core issue. Refer to health@gov on patient appointment management. Question 20. A radiology administrator is considering a new approach to improve patient satisfaction. After evaluating patient feedback, he finds that wait times for radiology results are too long. What strategy should the administrator implement to address this concern? A. Implement a digital results delivery system for immediate access. B. Increase the number of radiologists reviewing images. C. Allocate additional time for radiologists to review images thoroughly. D. Reassign staff to reduce delays in the diagnostic process. Answer. Correct answer. A. Implement a digital results delivery system for immediate access. Explanation. Option A is correct because digital results delivery improves turnaround time by allowing patients to access their results as soon as they are available, thereby enhancing patient satisfaction. Option B and C may improve quality but not reduce wait times. Option D does not address the technological or procedural inefficiencies. Refer to AHRA patient satisfaction in imaging guidelines. Question 29. The radiology department is implementing new technology for image processing. Which of the following factors should be prioritized to ensure the successful integration of the technology into clinical workflows? A. Ensuring the technology provides a higher resolution than existing equipment. B. Providing comprehensive training to all affected staff. C. Acquiring the most expensive technology on the market. D. Limiting the use of the new technology to the highest priority patients. Answer. Correct answer. B. Providing comprehensive training to all affected staff. Explanation. Option B is correct because staff training is the most critical factor for ensuring smooth integration of new technology into workflows. Without adequate training, even the best technology can cause operational disruptions. Option A may improve image quality but does not guarantee successful implementation. Option C does not guarantee that the technology will meet workflow needs. Option D limits the potential of the technology and reduces its impact. Refer to American College of Radiology, AHRA Technology Integration Guidelines. Question 30. In reviewing the department's financials, the administrator notices a significant rise in the cost of consumables for imaging procedures. What should be the administrator's first action to address this issue? A. Negotiate with suppliers for low prices on consumables. B. Conduct thorough inventory audit to identify potential wastage. C. Reduce the number of imaging procedures performed per month. D. Switch to less expensive, lower quality consumables. Answer. Correct answer. B. Conduct a thorough inventory audit to identify potential wastage. Explanation. Option B is correct because conducting an inventory audit can help identify areas of wastage, overstocking, or inefficiencies in supply chain management, which can then be addressed to reduce overall consumable costs. Option A may provide temporary relief but doesn't address inefficiencies in usage. Option C reduces service availability and does not address cost inefficiencies. Option D could compromise patient care quality. Refer to AHRA financial management principles and healthcare supply chain best practices.